Hello. My name is Jones, and today we are going to look at behavior modification. Behavior modification is a method of strengthening desired behavior or response through a positive or negative reinforcement of adaptive behavior or the reduction of maladaptive behavior through extinction, punishment, or therapy. So within this discussion, we are going to define behavior modification. We are going to look at the positive and the negative reinforcement. We are going to look at the indication for behavior modification. We are going to look at the behavior modification techniques that can be used. And also, we are going to look at some behavioral theories and theorists that have contributed to behavior modification and the knowledge about behavior modification. So, as defined, behavior modification, when you are now using it in mental health, we are looking at it as strengthening desired behavior or response through a positive or negative reinforcement of adaptive behavior or the reduction of maladaptive behavior through extinction, punishment, or therapy. Okay, so an example I can give here is an employee who has worked extra hours just to finish their tasks, arrives at work on time, and sometimes even skips lunch just to complete the assigned job. Okay, so this is a hard worker that necessarily we are looking at, or a hard worker that we are trying to define. A person who is really hard working. Now, after a month of hard work, the paycheck is delayed. Weeks and months have passed and still the salary has not been released. What will necessarily happen is that the efforts will be affected for this individual. The motivation to do the job will be affected by this individual because of unpaid salary. They might still go for work, but there will be change in attitude, energy, and motivation for these people to work. So, for working people, receiving a regular and on-time paycheck is a positive reinforcer that motivates the employees to do their job well. If this motivation factor is lacking, then expect even the person who works hard, to be less efficient performer, or expect your employees to be less efficient performers because of lack of positive reinforcement. Behaviorists believe that a behavior can change through a system of rewards and punishment. Okay, so let us talk about positive and negative reinforcement. Positive reinforcement, negative reinforcement. So negative reinforcement is more like punishment, but the behaviorists, they look at it as negative just reinforcement. Okay, so when you are looking at positive reinforcement, this is provided by giving a person attention and the positive feedback. For example, a child has successfully made it through the night without wetting the bed. So you, as a parent or guardian, you can acknowledge the child's behavior in front of the family during breakfast. To acknowledge that, wow, P or X, that's the name of the child, today slept well on a dry bed without bedwetting. This will make this child feel happy, and it will act as a positive reinforcement. Okay, so then we also have negative reinforcement on the other hand. So negative reinforcement is done by removing a stimulus after a behavior has occurred to prevent it from occurring again. An example that I can give here is a student who becomes anxious when he is seated at the back during classes. Such a student may ask their lecturer, teacher, so that they can sit in front. This is to prevent the anxiety that they have when they are seated at the back. So you would have removed the negative reinforcement of sitting at the back by making this student sit in front. Hence, they will not be anxious. Okay, so that is what we call that is what we call removing the negative reinforcer. So that's why they did not use necessarily as punishment. Okay, otherwise they would be saying positive and punishment as reinforcement. So negative reinforcement necessarily can be looked at that bit of angle of punishment, but not necessarily that you have to punish the student in order for you, the student or the person involved, in order for you to start receiving the required or desirable behavior. But otherwise, here, what is important in negative reinforcement is removing that factor which is affecting the good results or desirable results that that one necessarily would produce. Let's say, for the first example, on positive reinforcement, if the child, let's say, bedwets, you can remove the drinking of water, let's say after 19 hours, to reduce the bedwetting, because drinking of water may make the child frequently go to the toilet or mictulate, causing the child to bedwet. So you can remove that, so that now becomes a negative reinforcement, which is trying to help the clients adapt to more desirable behaviors. So behavior modification can be used in the following situations. That is, in obsessive compulsive behavior, in attention deficit hyperactive disorders, in phobias, in enuresis, or those with the bedwetting, in generalized anxiety disorder, or in separation anxiety disorder. You can use behavior modification. Okay, so behavior modification, we are just simply trying to fine-tune undesirable behavior to desirable behaviors. So the behavior modification techniques that are there that necessarily are part of this discussion is the ABC approach. So the ABC approach, that is A for antecedents, B for behaviors, then C for consequences. So antecedents, that is, we are looking at events that occur before the particular behavior is demonstrated. Okay, so what comes directly before the behavior? So those are the behaviors that are seen before someone necessarily shows this undesired behavior that they tend to show that needs modification. So, and incidents, we look at those behaviors that may necessarily precipitate the undesired behavior, the behaviors that will happen before the main incident happens, okay, which might be undesirable. Then B, that is behaviors, now showing the actual behavior. So the behavior is developed as a result of presence of the antecedents or the precipitating factor. So what does the behavior necessarily look like? How does this behavior necessarily come in? So that is necessarily what you're looking at, the behavior. So the behavior part here is the actual thing happening. Okay, then C is for consequences. So these are the events that occur after the behavior, or what comes directly after the behavior. Do you whip the child for bedwetting? So those are the consequences of bedwetting. Okay, so in the ABC approach of behavior modification, if you have been learning surgery, you can say we have the pre-op, the intraoperative, and the post-op. The pre-op, the precipitating behavior, precipitating events. Then the behavior, that is the operation itself, the act itself. Okay, that is the intraoperative part. So the behavior now happening. Then post-op, that is the consequences. Okay, so consequences. So that's how these levels are. So the pre, okay, the during, and the after. So we are calling the ABC approach, that is the antecedents, the behavior, and the consequences. So after the ABCs are assessed, the data is gathered and analyzed, and you can now identify the inappropriate behavior through analysis. The inappropriate behaviors will be observed and targeted and stopped, while the appropriate ones, they can be identified, developed, strengthened, and maintained. Okay, so this is necessarily what you do in behavior modification. Okay, some behavioral theories and theorists that you need to look out for in order to understand more about behavior modification. We can talk of Ivan Pavlov. We can talk of Barras Friedrich Skinner, okay, who focused on observable behaviors and factors that bring about behavioral changes. Okay, so classical conditioning by Ivan Petrovich Pavlov, okay, who was a Russian psychologist, physiologist, and physician, who is widely known for providing the best example of classical conditioning through experimentation on dogs. Okay, so through experimentation on dogs, and I would encourage you to look necessarily at that. Okay, then looked at this and called it classical conditioning. So classical conditioning principles states that a behavior can be modified or changed through conditioning of the external stimuli or conditioning. Then operant conditioning, which was done by Barras Friedrich Skinner. Okay, this is an American psychologist who developed the operant conditioning. Operant conditioning states that people learn their behaviors through their past experiences, particularly those which are constantly reinforced. Okay, so there you have it. We have been looking at behavior modification, okay, as one of the skills of a mental health nurse. Okay, so behavior modification is a method of strengthening desired behavior or response through a positive or negative reinforcement of adaptive behavior, or the reduction of maladaptive behavior through extinction, punishment, or therapy. So there are positive and negative reinforcements that can be applied in trying to modify behaviors, and the indication for behavior modification include obsessive compulsive behavior, attention deficit disorder, phobias, enuresis, generalized anxiety disorder, separation anxiety disorder. So in all these you can use behavior modification. Then the behavior modification techniques includes the ABC approach: the antecedent, the behavior, and the consequence. Okay, so after the ABC has been assessed, the data is gathered and analyzed. Inappropriate and appropriate behavior are going to be grouped. So the inappropriate behavior will be observed, targeted, and stopped, whilst the appropriate ones will be identified, developed, strengthened, and maintained. So by this, then you are going to modify the desired behavior of an individual or the person that you're trying to give therapy. Then for further reading and understanding, we have talked about some theories and theorists, okay, that you can necessarily look at to consolidate your knowledge on behavior modification. So we have talked about Ivan Pavlov, Barras Friedrich Skinner. Okay, so these contributed a lot through observable behaviors and factors that can bring about behavioral changes. Okay, so we have talked about classical conditioning and operant conditioning, which necessarily help in behavior conditioning or gives more information about behavior modification. So from me, I'm saying thank you very much and keep studying.